Hi, my name is Rachel. I'm going to be sharing the interview portion of our project. So I actually interviewed Dr. Sunita Puri. Dr. Puri is the clinical assistant professor of medicine for palliative medicine and the supportive care team for the Keck Hospital of USC Norris Comprehensive Cancer Center, and LAC USC Medical Center. She's an expert on this topic because of her years of involvement with palliative medicine. With the recent passage of the new law, our hospitals needed policy written to incorporate the law into practice in our institution. Dr. Puri has been consulted to write that policy, and she has given many lectures and in-services to medical and hospital staff about the details of the new law. So I asked Dr. Puri, how is this law similar to or different than other states' laws that I have? And she said that the law in California is very similar to many other states, particularly Oregon. I asked, how do we deal with healthcare professionals who morally object to participating? She said, under the law, no healthcare professional is obligated to participate in any way. In our policy at the hospital which I work, Norris and Keck Hospital, she has specifically written that under the law, physicians have a right to choose not to participate in this act on the grounds of moral objection, and they are completely protected in exercising that right. I asked, what is the cost of obtaining the medication, and is it covered by insurance? Dr. Puri responded that the estimated cost is around $3,000, which includes both the medication, which is likely secobarbital, and additional medications to assist in the alleviation of any side effects, such as nausea and vomiting. Different insurance plans have different policies on the coverage. None of them, however, are allowed to advertise that they cover this medication. I asked if this is a medication that could be administered in the hospital setting, or is it done solely at home? And she said that it is intended for outpatient use. And in the hospital which we work, Keck and Norris hospitals, we specifically state in the policy that the medication cannot be ingested on the premises of our hospitals or clinics. I also asked, where do we refer patients who are interested in this law? They should be referred to their primary care doctor, Dr. Puri said. If the primary care physician determines that the patient meets criteria, they need to make 2 oral requests at least 15 days apart directly to their doctor, and it should be recorded in writing. I asked if we had better symptom control and pain management for patients who are dying, would we actually have a need for this law? And Dr. Puri responded that evidence from Oregon and Washington demonstrates that the majority of patients who are in possession of the medication actually are already enrolled in hospice care. This suggests that when optimal symptom management is in place or is being attempted, there is a population of patients who still seek the medication. I also asked what type of feedback has she been receiving from her colleagues, and she said reactions have been mixed. Staff who morally object to being involved are allowed to make that choice. However, there are many colleagues who advocate for this law and are happy to see it put in place. And I also asked, can a patient be receiving hospice care and also receive a prescription for the medication? And she said, yes, absolutely. In fact, as noted above, in Oregon, most patients who have obtained this medication are already enrolled in hospice care. Thanks for listening, and once again, I thank Dr. Puri for giving me time to complete this interview with her, and I hope you enjoyed. Thanks.